Hi, Kevin Henry, Managing Editor for Dental Economics, here today with my good friend Dr. Jonathan Bregman. And Jonathan and I were speaking a little bit off camera right before we started this interview about the importance in today's economy of growing your practice from the inside. And tell the viewers how they can grow their practice from the inside, or what are some of your thoughts on that?
Kevin, we're facing some pretty tough economic times right now. Everyone is all across the country, and we also don't know when those tough economic times are going to turn around. And one way that I think that dentists, especially now, and really all along should be, but especially now, is to look to see what you already have within your practice and how can you maximize what's already there. Busyness, or how booked your practice is, how booked the doctor's schedule or hygiene schedule, using that word busyness, most people think of it just as how many new patients do I have coming in. But it's really a mix of many more things than that. It includes the new patient numbers, but it also includes how effective is that preventive recare system, that hygiene department, in getting people back. How effective is it to get care, the booking and the scheduling of treatment out of the hygiene chair, because well over half of the doctor's treatment that the doctor does comes out of hygiene, even sometimes up to 2/3 of that will come out of hygiene. What is it that's happening with those new patients as far as accepting the treatment plan? And the other part of the busyness is what is the mix of procedures that are being offered. Instead of referring a lot of things, what can be kept within the practice to help to fill the schedule and to make it more productive. So I think that there's a lot that we can do working from within and looking at what we have. And the key that I always look at is that we're talking about enhancing patient care. And it's the old adage, do what you do really well and the money will follow. Once we enhance patient care, which is what I am all about, then we will also be enhancing the financial bottom line of the practice as well, by being diligent and looking at these different indicators of the practice in total, the hygiene department specifically, the doctor specifically, and then the mix of procedures that are being offered to the doctor, to the patients that come through that practice.
And I know a lot of times a doctor will go to a trade show and maybe he'll decide to purchase a soft tissue laser, let's say, or something along that line.
Mm-hmm.
And certainly that's adding to the practice, but at the same time, there's a lot of things involved there. The schedule has to be incorporated for that. The team has to be brought on board. So what are some of the things about adding something into the practice mix and really trying to grow that practice from the inside? What are some things that the dentists out there really need to keep in their mind if they're going to do that, would you say?
Technology is an important piece to it, there's no question. I think that, and I've always, throughout all the programs that I've done around the country and out of the country as well, it's about making decisions for the right reasons. Why are you choosing this technology? What is it that you're trying to accomplish? And once you decide for your reasons, not because of what a company says or a friend says or a rep or someone says, but that the reasons make sense to you for how you want to practice, how you want to live your life, the kind of care you want to provide, when that solid decision is made, then it's a matter of saying, what do I now need to do to maximize this investment? And it's a combination of making a time commitment for the doctor to learn this completely, a time commitment for the entire team to learn and understand it, and a plan to let the patients know the technologies that you have. So you have all these technologies, your patients don't even know what mix of services that you're providing. How are you going to do that piece of it? And then, as you mentioned, how is this going to be integrated into the practice, both on a time and scheduling fashion? And I think that the financial bottom line, like what's the return, it's always ROR and ROI, return on investment, and return over time. what is that? What is that going to be? Is it that it's going to shorten time frames because procedures will be more efficient? Does it mean that you're going to add some procedures in that you weren't doing before and maybe referring? So now you have new procedures and that you were not billing out before, maybe referring. It could be a lot of different things that come into play. And I think with many technologies, we also can't discount the fact that if it makes dentistry less stressful, a little easier to do, and more fun, then that has huge value also. So even if the financial bottom line isn't huge, those factors also, I think, are really important. And the way we use these technologies and talk about them, I think that we create what I like to call and others call that wow experience that our patients get. And they will tell others. And creating that great experience and having those very happy patients go out and tell their friends and neighbors and coworkers and family members about it, that's going to be your best emissary in the community, and that's the way we're going to get really great new patients coming in. And we can't forget to factor in that by basic practice management consultant standards, each new patient, each good new patient that's brought in by a patient referral, best new patient, is easily worth over $1,000. So I think looking at how we look at technology, what it will do for us, to me in summary we have to have an upfront commitment to getting this for the right reasons. I'm committed to the time it's going to take both in and out of the office for myself, if I'm the leader, the dentist leader, as well as the team. How do I integrate this within the systems of my office? And how can I and the team together have a buy-in, because we know what's in it for the patient, because that's better care, what's going to be in it for us as far as the business of dentistry, but critical, it's are we doing better quality patient care? And that to me, ultimately it has to come down to, because our patients, they know when you're trying to sell them something,
Sure.
and they know when you have gotten invested in a technology that will make their care better. That feels good to you, it feels great to the team, it feels great to the patient. And it is this old saying, and I've heard it first from Linda Miles, and many people have heard from. She said, oftentimes she has said that the team members that are working in an office see a new piece of technology and they think, oh, there goes my raise.
Right.
But in actuality, if they look at it as we're going to maximize this, and that is the key not only to my raise but to a bonus, that's going to be a whole different scenario, and it has to do with how it's introduced into the practice for full buy-in by the team.
Okay. Good thoughts. I appreciate it, John. Thanks.
Okay, you're welcome.